Thank you. Thank you again. Next on the list, I have Jessica Hauser and Patrick McClellan. Welcome, and please state your name for the record.
Thank you. Good morning, Madam Chair and committee members. My name is Jessica Hauser, and thank you for considering my testimony today. My name is Jessica Hauser. As I said, my husband, Jeremy Hauser, and I are both citizens of Minnesota, and we're asking for safe and legal access to medical marijuana for our little boy. If you asked me on the day our son Wyatt was born if I supported medical marijuana, I would have said yes, of course, for those who need it, not knowing that in the coming year my son would be one of those who needed it, and I would become a passionate advocate for medical marijuana to give to my sweet baby boy. When our son was 7 months old, he was diagnosed with a rare and very difficult to treat form of epilepsy called infantile spasms. Despite its name, it's not something he is likely to outgrow, and it is incredibly devastating. He suffers nearly 100 seizures every day. He's already had 40 since we've been in this room. These seizures rob him of his cognitive development, his personality, and his overall quality of life. If they continue, his future is at best uncertain. He is now almost 2 years old, and he's very far behind his peers developmentally. And we still don't know why he has these seizures. He has no other diagnosis. We are very blessed to live in Minnesota and work with some of the best doctors in the world. And under their guidance, we have been able to provide Wyatt with the best treatments and medical care currently available. Unfortunately, these treatments have done little to stop his seizures. He has tried and failed 10 medications, tried diet therapy, various vitamin and enzyme supplements, and had no success. Most of these treatments aren't without serious drawbacks themselves, many with side effects that are difficult for adults to tolerate, much less an infant. He has endured 7 weeks of steroid injections that my husband and I had to administer to him, a course of oral steroids at a dose that would be much better suited to an adult, and various anti-epileptic medications that sedate him at the same time causing insomnia, affecting his coordination, making him very irritable and uncomfortable. And essentially they cause him to live in an altered state. They so seriously affect his quality of life, it looks like he's intoxicated much of the time. He is currently on benzodiazepines, Valium-like drugs that do cause dependence and have a high potential for abuse. We must monitor these medications very closely. Stopping these meds could cause serious withdrawal symptoms, including more seizures that cannot be stopped and hallucinations. However, if these worked, we would be tremendously grateful because they are being administered to Wyatt with compassion and care and through risk-benefit discussions with his doctor. However, they haven't worked, and we are literally running out of things to try. As we have been researching medical marijuana for our son, we learned it is helping children with epilepsy like his, resulting in greater seizure control and with minimal side effects due to the low toxicity of the medicine. We have met the parents who have shared these stories, and we've read countless stories. We have also spoken to researchers from a biotechnology firm in Oregon. They are using existing research to develop lab-tested marijuana-based medicines designed to treat specific symptoms, including seizures, by tapping into the potential of all the medicinal applications the plant has to offer. They use this research to help patients, physicians, and legislators in that state really understand the science of marijuana. Children in Colorado and Oregon and other states where medical marijuana is legal are receiving this treatment now, and they are seeing results now. Unfortunately, the current laws in Minnesota prohibit us from accessing this real and viable treatment option for our son. We love Minnesota. We love our family, friends, and our lives here. We have an amazing network of support, and we love our jobs. We respect and care about the physicians that treat Wyatt and want their guidance in all medicines that we administer to him. We don't want to move, but if this law doesn't pass, we will be forced to leave to give our son the chance to have a better life, a life that he deserves. We will need to go to a state where we can provide our son with the medicine that he needs, with new doctors, and without our current support system. It is not easy for anyone to move, and when you have a child with special needs and a complex medical situation, it is 1,000 times more challenging and heartbreaking. We hope that lawmakers also consider a recent call to action included in a statement by the National Epilepsy Foundation and support appropriate changes to state laws to increase access to medical marijuana as a treatment option for epilepsy, including pediatric use, as supported by a physician. With that, I am begging you, the lawmakers of this state, to make this medicine available to all the patients of Minnesota who need it, and who need it now, especially children like my son Wyatt. Thank you very much for your time.
Thank you, and thank you also for bringing your testimony today. Members, do you have any questions for Ms. Hauser? Thank you again for coming.